Hello everyone. First of all, I would like to congratulate all the final BDS students who have completed got their results, and I, Dr. Shweta Acharya, on behalf of Edge Dental PG, welcome all the interns, especially because this particular session is for the interns. Now, why is it planned for the new interns preferably? I would like to say now, the biggest confusion as soon as you finish your final year, you give your exams and you're tired of those subjects and quota completion and everything, and then the results come out that you've passed. The next question or the next confusion that exists in everyone's mind is what to do after internship. Should I go for MDS, or should I directly jump into clinical practice, or should I do a few fellowship courses or certificate courses and then go in for practice? This is a general confusion each one of us goes through. It's true for 100% of the interns, I would say. There are definitely a few 10% people who are very sure of what they want to do. It could be practice but what I would like to suggest to all of you is, it is very important that we do not waste time. So, you are not going to lose anything if you study. It's always going to add up to your knowledge. So, personally, if you ask me, I feel each one of you should start preparing for the NEET entrance. Somewhere down the lane, if you feel that you should practice, you can practice. You may feel like doing a fellowship, but now the MUHS fellowships are again coming under NEET. So possibly you can enter the fellowships. The Army Dental Corps also takes the NEET exam results as their criteria. So NEET-MDS entrance is not going to be a waste. Your mehnat that you will take to clear the NEET-MDS is definitely not going to be a waste, because you would study, you would have your concepts more clear, you would probably not have studied a subject well in your BDS, but you would touch it when you're doing your internship. So all of these things are going to help you be a better doctor if not doing MDS. So this is the confusion that each one of us goes through once you finish internship. Now I have just planned this session only because I would like to help you to decide you should go in for MDS or practice. Now there is something called as a SWOT analysis, which normally management people practice for their programs, for their clients, for individual, for their company, for a particular project. Everywhere they follow this SWOT analysis. Now, I would suggest that each one of you give yourself some time, one evening or a day preferably, a complete day, analyze yourself according to SWOT. Now, what does SWOT exactly mean? Basically, you have to divide yourself into strengths, weaknesses, opportunities and threats. Now, you have to do this for yourself. Like, what are my strengths? What am I good at? Now, each one of you individually, someone may be good at basic subjects, someone would be good at clinical subjects, someone would be good at studying at the night time, someone is good at studying during the daytime. All of these criteria are going to help you plan what you need to do. So you just need to jot down what are your strengths. Then what are your weaknesses? Now weaknesses could be, again, you may really hate a few subjects which are important from NEET point of view, or you may be a bit lazy, or you are not a person who will study for a long time. So you feel कि नहीं यार इतना तो मैं पढ़ ही नहीं सकता, तो जाने तो NEET देने की क्या फायदा. You may have all these as your weaknesses. So you can jot them down. And what are opportunities? Now, opportunities is one section, there are so many newer opportunities coming up, like a lot of government programs are coming up. There are a lot of places, a lot of openings in the corporate sector for dentists. Also, if you go ahead and do maybe public health, or if you do masters in a PG diploma in healthcare management, all of these are newer opportunities, newer possibilities that you can do post BDS. So again, those are the newer opportunities you have. Also, your opportunities could be different. Maybe, you have a relative abroad or anything. You can even think of those opportunities, that if I give my NEET, would I be possibly ready to give exams abroad, or if I do my MDS here, would I, because each country has its own rules. So you'll have to choose the country and then check what the rules are for that particular country. And then there are threats. Now these threats could be anything, you know. A lot of people have this idea that there's a lot of saturation in dentistry. So would I be able to sustain? Should I completely change my profession? Now, these could be the threats which changes from individual to individual. But personally, if you ask me, every branch for that matter is saturated, if you feel. And every branch has people who are doing much better than the others. So obviously there are qualities in each individual has to perform better than the others. So we need to groom ourselves. I would like to say it in those words. You need to groom yourselves with soft skills, with the subject knowledge, with possibly learning the newer things which are coming into the market, because nowadays patients demand the new things. Patients can Google, patients know what are the new things. So you should be updated. And so for that particular information, you know, there are a lot of patients who know that MDS exists, who know that there is a specialist for endodontic treatment, who know that there is a specialist for implant. So for all of these things, you need to be updated, and possibly to be updated, doing MDS is an easier way out, because when you do in your, whatever you do in your 3 years is going to help you remain updated, is going to teach you how to be updated. So doing MDS is going to be the easier way out to sustain in life, because obviously if you want to stay in bigger cities, MDS is a mandate. And if even in the smaller cities, 10 years down the lane, MDS is maybe a requirement. So it will definitely help you. And if you are still confused, I sincerely feel it's not a waste of time to study, because it's going to invest, you would be just investing your time instead of just spending it. So I would like to tell all of you ki, give yourself a day or two, do a SWOT analysis for yourself, see what your strengths, weaknesses, opportunities and threats are. That will definitely help you choose what you want to do, MDS or practice post your internship. If any queries, please post in the comments. Do like and subscribe to our channel Edge Dental PG. Thank you.